the burnout phase of the exhaustion, with depletion of energy, the detachment, and the decreased sense of accomplishment. You might start having some symptoms that are likened to anxiety and or depression. You're just having anxiety reactions that might manifest in different ways. Some might be anger outbursts, or you don't want to be around anyone.
Hello guys, this is Dr. Anita Lwanga here. I have my friend Dr. Tamara Beckford, who is a multifaceted entrepreneur. I'm so excited to talk to her. She is going to tell us all about what she does. But before she does that, I'm going to introduce her and let you guys know what she does. So she's a board certified emergency medicine physician, the first emergency medicine physician I'm actually interviewing on our show. She's a burnout coach, an author, a speaker, and CEO of You Are Caring Docs, which is geared towards high achieving women and helping them manage their life and reduce burnout. Not only does she do all of these things, in addition to that, she just started a new business to support women or individuals who want to lose weight by helping them make the changes to their lifestyle to help them lose weight. And in addition to that, get the medications that they need to help them lose weight. Dr. Tamara, Dr. Beckford, thank you so much for agreeing to be on our show. Please tell us a little bit more about yourself and how you came to this journey of owning multiple businesses and doing all these things. I'm really curious. Please tell us.
First of all, I want to thank you, Dr. Anita Lwanga, for having me on the show, and thanking you for sharing me with your audience. For those of you who don't know, so Dr. Lwanga and I are friends in real life. And so it's really an honor when your friend asks you to be part of their show. She mentioned I'm Dr. Tamara Beckford. I am a board certified emergency medicine physician. So that means that I work in the ER. I am currently located in Houston, Texas. I've been doing emergency medicine now for over 15 years within training and out of training together combined. I can't believe I have to say these numbers, but it's almost 20 years, which I think is very unreal. But it's been an honor to be able to take care of patients who are at their most vulnerable times and to be able to support them and their family that way. Supporting patients is something that I get to do as an ER doctor, and supporting women and also companies and people is what I get to do outside of the ER. And that's where we come with Your Caring Docs. So Your Caring Docs is my company that I've had for a couple of years now, where I use my talent and all that I've learned and my passion to support those who are going through stress and burnout, especially women, high achieving women, to have them restore their joy, their peace, and bring back that meaning and balance in their lives. With that, I recognize the effect that stress does have on people's lives. And sometimes you also have done everything you can to lose that unwanted weight and you're unable to do. And that's why I'm started and I've opened up my other company with this truly balanced wellness care. And with that, I'm able to help those in Texas now who need some extra support in losing that unwanted weight through our nutrition, exercise, and also through any medication that might help to support them on their journey. So thank you so much, Dr. Nita. I can't wait to pour into your audience. So I'm ready for all the questions that you have for me.
Perfect. So the first question I want to ask you is primarily for our audience. So what is an emergency medicine doctor? What do they do? And what kind of training do you need to go through to be an emergency medicine physician?
Absolutely. Great question. Because whenever I meet people and I tell them, yeah, I work in the ER, they're like, great. So where's your office? So the office is literally the emergency room. So as an ER doctor, our training incorporates. So yes, we have done, if you want to go through the high school, the undergraduate, I myself have an undergraduate degree and I also have a master's. So that's now 6 years. And then I did 4 years of medical school. So that's 10. And then I did 3 years of training specifically to become an emergency physician. So that's after medical school, 3 years of training. As an ER doctor, the training that you get is you've trained on a little bit of almost all the specialties. So you have training on orthopedics, trauma, you have training on all the intensive care units. You have training on also anesthesia. You have a little bit of training, airway training, ear, nose, and throat. And there's a reason why we get trained on all these different specialties. Because emergency medicine as a specialty, our job is to stabilize the emergencies of all the other specialties. So that's why we get trained in pediatrics. So if there's a pediatric patient that comes into the emergency room, we take care of them. If there's a pediatric trauma that comes in, we take care of that. If you have an adult coming in with emergencies such as heart attacks, congestive heart failure, flare ups, which we call exacerbations, patients who are coming in with flare ups of COPD, asthma flare up, which we also call those exacerbations. But then sometimes you might have that belly issue, right? You're having that abdominal pain in that lower portion. We check it out and it's your appendix. So we are the doctors that really take care of the emergencies, and we also take care of patients who unfortunately are not able to see their family doctor at a reasonable time. They end up coming to the emergency department and we see them. We do what we call a good small version of a patchwork, which I think is the best way to describe it. And I'm really saying a patchwork because I want to emphasize that most of the times, if you're coming to the emergency department, we're not doing a long-term maintenance. We're doing a patchwork to get you from where you are to be able to have you stabilized enough to see either your primary care doctor or your family doctor, or if you need to be admitted to the hospital, to be seen by that admitting team when they're there either the next day or later on in the day. So we maintain you and keep you alive until our colleagues are able to come and continue the work.
Yes, ER is such an exciting field. It's so dynamic and you do a little bit of everything, but it's also extremely busy.
Absolutely.
With you just naming all the things that you do, you have to have such a wide breadth of knowledge in order
Mhm.
to be able to manage such a wide breadth of patients from like a newborn all the way to an older person, ICU to like primary care. That is a lot of scope that you guys cover. And with that, I can imagine you have a very busy career and you also have a family. So I was curious, like with everything on your plate, what inspired you to start You Are Caring Docs?
Great question. Your Caring Docs was inspired through the pandemic. So during that time, there's one thing that happens in our lives as humans. I just went through the repertoire of how many years of training that I've had. And after I've gotten to the end of all that training and I'm working in my field, it took me a long time to get there. I'm working in my field and I'm excited. I'm continuous to do this. Then now I'm getting to almost the 10th year. And I've been doing what I love to do. And now I feel comfortable. I don't feel so much of a novice. I'm not questioning as many of the decisions that I make. But then what starts to happen is that you look at your life and you're wondering, is this all that I have to give to the world? So I started to do some introspection. And the answer for me was no, you have a lot more talents that you can give to this world. And in looking and trying to decide what is it that I wanted to do at first, I thought maybe I want to do this, then that. But then I recognized that self care is such an important aspect and people are overlooking it. I don't know why God put that on my heart. Like self care. I'm like, okay, that's great. So self care is so important. But then I also recognize why it was so important because a lot of people are going through burnout and it's the pandemic. And you've mentioned I'm an emergency physician and I should be going through burnout during the pandemic, but I didn't. And I'm like, why is it that I'm not going through burnout? If it's anything that I'm actually thriving during this time, why was I thriving? Because of all the skills that I've acquired prior to the pandemic starting in 2019, when I just started to do a lot more introspection. I started doing a lot more work on myself, on my mind, work on just positive intelligence work on recognizing my thoughts are not who I am. Like I might have negative thoughts, but it doesn't mean that I'm a negative person. I can choose. I have the ability to control certain things that I felt were just automatic in my state and in my mind. So when I recognized, that's when Your Karen Docs came about, the depth of what Your Karen Docs does came about. And I recognized that I have to use what I'm learning and share it with others because there's no use having this light and covering it up with a basket, right? And be able to shine that light on others, have others recognize these tools, be able to help others who might be in the place where I was. But even though I didn't feel burnout in the pandemic, I absolutely had gone through it before. And what did I do right? What did I do wrong? What are some things that I have done during a time when I should have burnt out? So what are some tools that I can use and show others? And so that was the birth of Your Karen Docs. It really came about during the pandemic when I recognized I should have been in a more of a negative state, but instead I was in a state of thriving.
Wow, that is so amazing. And I love how you're carrying Docs and the high achieving women with an attitude of serving. Like that speaks volumes, because it's easy. It's not easy, but I think a lot of people would intuitively assume that perhaps you came from a place of burnout. And sometimes when you're coming from a place of burnout, it can be great because you can definitely relate. But if you're still in that state of burnout, sometimes there's, or what we say can be tinged with our background of burnout. But I love the fact that you're serving with an attitude of I'm thriving, and what am I doing that is causing me to thrive that I can share with other people, and that you genuinely want to serve. I truly love that. And I'm even more amazed. We were just talking, we were doing an interview on my show, and you were telling me that you have started Truly Balanced Wellness Care, which is a service to help people lose weight. I'm like, wow. How are you start? Like, where are you getting all the energy to start another business, and why? What is driving you? What is your passion? Why are you serving people through Truly Balanced Wellness Care? And who is the target audience? Who do you want to help?
Absolutely. This passion for service, I think it's embedded in almost all of us who decided to throw away, and I'm just kidding right now, well, invested is what we did in our 20s, our late teens for undergrad, in our 20s and undergrad, for those of us in most of the 20s for med school, in order to help those around us. We want to leave this earth better than how we came in. And as we attain more and more skills, I feel it's important to use those skills to help mankind and to really uplift those within our society. How did I get the energy to start Truly Balanced Wellness Care? It's important to recognize too that when you have this passion, then you recognize that, wow, you can find the energy to invoke your passion. However, there's always a give and take. As I said, I'm a very reflective person, and just how I reflected on those times when between those years when I started to feel more confident as a doctor, getting to year 10 of just practicing medicine in the ER. There's also a period where I became a nocturnist in the ER, which basically means that I worked only nights. And I did that for the last 6 years. And so with working nights for the last 6 years, there's so many things. You and I discussed this on my show that working nights does to your body, to your hormones. And I recognize that this is not something that I can do and sustain for the rest of my life, but I do want to be able to still provide care as an ER doctor. So I made the decision to reduce the amount of hours that I would allocate to emergency medicine. And with that, that frees up hours for me to allocate to my business. So I get to now allocate, I'm still using the same amount of time, but I'm using it in a way that's better for me and for my body. And I'll still be able to do the things that inspire and fuels my soul, which is the service.
I love your answer, and I love how practical that is, because I think especially not only as women, but as humans, look at people achieving so much, and we're like, okay, we have to hustle hard too to also achieve the same amount or whatever we have on our plate. We have to hustle hard. But I love how you say you took the same amount of time you allocated to working in the ER and reduced that and then put it towards your company. I think that's a very practical and realistic thing to do. And also your reasons why you wanted to shift away from night work. I think that's a very wise decision in terms of your long-term health and avoiding burnout. You do so many things. What do you find most rewarding, or what is the most rewarding part about what you do? Because you have a heart of service, but what makes it so rewarding for you in simple terms?
Absolutely. So I think that there are different rewards where you're providing the different services. So for the service for Truly Balanced Wellness Care, I'm just starting that service. So I know that reward is coming. And when we do a part 2, I'll let you know. But for an emergency department, I think the great reward for being an ER doc is having someone coming, and this is also, I think it's just medicine in general. You have someone who's a complete stranger. They come in to the emergency department in a state. It either could be a state of anxiety, anger, despair, frustration, fear, but they're coming in. You as a doctor, what I get to do is I get to see that person, connect with them emotionally in a short period of time. They have to trust me because they have to tell me their deepest, darkest secrets. And I have to hold that secret. But not only that, but I use the information that I learn to help them. And I pour that back into them right there and then in order to uplift them or to just give them a different point of view or all this stuff while we're doing all this diagnostic thing. So yes, you're going to get your antibiotics. Yes, you're going to get this. Yes, you're going to get that. But I also want you to understand why this is going on. And these are the steps that I'm taking. And this is why I'm taking these steps. And this is why my plan is this. Do you understand? Yes, no. Okay, you don't understand. Tell me what about it that doesn't make sense. And okay, and you re-explain, get them to make sense. So now they come from a state of just being tense, and then they're a little bit more relaxed. Why? Because you've worked with them. But how often do you get to meet somebody and then within 10 or 15 minutes, get them from a state of just being super anxious, the most worried state, and just bringing them to a state of relaxation to the point that they're feeling confident so that when they step out, they can say, yes, this and this happened, and this is my next step when I go home. Or, yes, I'm going upstairs and this is what I'm waiting for. It's an honor to be able to do that because not too many people get that intimate interaction with a human at that deeper level in a short period of time. So human interactions are what I love about what I do and what I've done in Your Caring Docs, and what I'll also be doing in Truly Balanced Wellness is just really extrapolating on that. It's still that human interaction. When I'm coaching, I get my clients who are feeling like at their worst. So it's similar to what I'm used to seeing in the emergency department. They're either feeling flat, burnt out, and just like energy is feeling at a loss. And I get to build it back up. And then within a few weeks of just the coaching and working on their goals and helping them achieve their goals, I remember one of my clients, I read back to her what she said during the first coaching session. And she said, I don't even recognize that person. And I think that was like the greatest honor because she is now so empowered. She is really like stepping out her goals. She's achieving her goals and she's like really knocking it out of the park. And for that person who came in feeling so helpless, feeling that I have no control, which were her words, to like, I don't even recognize that person. Like, how powerful is that? And knowing that what you're doing, the service that you're providing, is going to empower that person to provide care for so many other people. And the care is not necessarily, it's just the fact that there's a ripple effect of your work in the work that they will do in their lifetime. And I think that's a great honor. And it's a great honor to be able to do that in both avenues.
Wow. I love so many things about what you say. And I think the first thing that really caught my attention that I could just resonate with is that it is an honor when our patients give us their deepest, darkest secrets. And we can use that information to help them. I really love that you recognize that. And as I was listening to you, I'm like, I want to stay healthy, but if I ever had to be in the ER, I'd want you to be my ER doctor because you're so nice. And you'll explain the whole plan. I'm like, wow. I'm like, thank God I'm healthy. In Texas, I'll be like, where's Dr. Beckford's ER person? I'm going there. I love how you break things down because those physicians were often rushed. But the fact that you take the time to explain things and make sure your patients understand, I really love that. And I love the other concept that you're taking. I've heard somebody say that knowledge is parallel, meaning if you have one piece of information in one part of your life, you can apply to another part of your life. So I love how you apply your just compassion, your love, your sensitivity, and your listening skills, and even your desire to help your patients to you are caring docs. It's almost the same thing. You're listening to what your clients are telling you, and you're helping them overcome the challenges that they have and improve their lives and reduce burnout. So I really love how, that information, you're taking it to another part of your life. And another thing I wanted to ask you, just out of curiosity, this is completely off topic, but did you ever think of becoming a psychiatrist? Like, I think you'd make it.
Interestingly, never thought about psychiatry. And now that I love interview my psychiatrist, I'm always so fascinated because of the more that we're learning, the more we read, the more we're learning about ourselves and about our minds and how our minds work. And what we thought was true driving force behind what we do and what we're realizing now is the driving force behind. So it's really fascinating. And I'll tell you this, when I first got introduced to psychology, I was completely confused in undergrad. I had no idea what this was. I didn't even do well in the class. I was just like, I still couldn't figure out what in the world was just going on. And then now many years later, like almost 20 something years later, I'm like, whoa, this is awesome. This is great. Maybe I just wasn't mature enough at the time. But now, would I have gone into psychiatry? Maybe. I don't know. But I love the connection. I love the humanism of medicine. And of course, I absolutely love the science. I wouldn't have done many years of science if I didn't. But I just love putting it together in a way that my patients feel empowered. I always love my patients leaving out feeling like, yeah, I know what's going on in my body. I think that is one of the feedback a patient gave to the hospital. Oh my gosh, Dr. Beckford was so worried about me and my diabetes, and she was upset that this and that. And so she made sure she taught me how to do this. And I was like, oh, wow, that's a great honor.
Yes, I love it. Oh, I love it. And I think your patients can tell if they're giving that kind of feedback, like you're not even their primary care provider and you're teaching them how to use their medication. That speaks volumes about how much love and care and attention you give to each one of your patients. I love it. And I love it. And I also realized as an ER doctor, you probably you do psychiatry anyway. There's people who have acute psychiatric issues and they come to see, or even not so acute. But I think that's also the beauty of ER. You have a little bit of everything.
Absolutely. We touch on everything. And you have to use that mindset in tapping and getting information from the patients, because sometimes patients are not aware of what's important versus what's not important. And you put the puzzle pieces together. So I have my patients talk and then I do a summary. And then I'm like, okay, or I'll hear one word and I'm like, okay, that's the important part. Let's go down this route. It's a mystery. It's allows you to tap into, you have to use the psychology on the patients. You have to teach them also the psychology so that they can be able to be empowered and not just go ahead on any negative thoughts that comes into their mind that will probably bring on anxiety, bring on their high blood pressure. Some of the things that we're talking about, like the breathing exercises, I use that on my patients. My little old ladies, and I just get nervous whenever I'm at the doctor's office. My blood pressure is not usually this high. So I said, okay, don't worry. Before I throw any meds at them, I'm like, already, I want you to listen to something relaxing. I'm going to turn the lights off and I'll be back in 20 minutes. And I'll step out and I'll watch your blood pressure from outside, because if I step in and it's high, when I'm outside and she's listening to the YouTube channel that I have her listening to, and she's laying there relaxed and her blood pressure is normal, then I know it's me. It's physically me in the room. And I've helped her in that respect. And it's all encompassing. In medicine, there's the art and there's a science. You have to put it all together and use it appropriately.
100%. And I love that how you give your patients like something to listen to on YouTube. I'm going to have to steal that as well, because definitely I think as doctors, we feel bad when our patients are like, and they're looking at us and we're like, I'm not going to hurt you. I promise.
I promise.
Yeah, it's easy to say, but it's not that easy to actually help people feel more relaxed. And speaking of how our body's connected, stress for sure can cause our blood pressure to go up. Stress can cause so many medical problems. We were talking about this before. As an internist for me, patients tend to come to see me because of chronic medical problems if they have other things going on, especially the world has changed post 2020, post-pandemic. So many people are suffering with stress-induced illnesses and burnout. So how can somebody recognize perhaps that they might have some signs of burnout? What should they look for?
Absolutely great. So, burnout by definition is a psychological and physical response to chronic stressors, especially at work. So, for those who are still working, here are some of the things. Burnout is really facet under three main portions. One is the emotional exhaustion. Two is the depletion or the detachment, I should say. So the depletion of the energy is emotional exhaustion. Detachment, that's the cynicism that you might have, and you're feeling detached from those who you're working with or what you're working on. And the third one is a decreased sense of accomplishment. So when we do tasks, we usually do tasks with the mindset that once we've completed said task, we're going to feel a certain way, which is usually a feeling of reward. It's a part of our natural system, our reward system. When you start losing that feeling of reward, then the likelihood of you wanting to continue that task goes away. And that happens in the form of burnout. So now, what are some ways to recognize the sign of burnout? One, if you're having emotional exhaustion, you are going to work, you're in the parking lot, but you do not want to get out of the car. You don't want to go back into the building. The thought of going into buildings, for some people, it might bring anger. For some people, it might bring sadness. If it's at its extreme point, you might be crying and you're just, I don't want to go in there. The detachment, the easiest way to explain detachment is if think about those working in the healthcare field. We have our patients that we're taking great care of. We have patients as in Mrs. Jones in room 5. But when you become detached, you start to become cynical. So instead of Mrs. Jones in room 5, it's the diabetic patient with the foot wound in room 5. You're just detaching yourself emotionally from that patient. You're attaching yourself emotionally from your job. You're cynical. You say things like, it is what it is. You're not going to be quote unquote pleasant to be around. You probably wouldn't want to be around your own self if you really saw yourself from the outside. And this is really stemmed from the exhaustion. You're just like physically exhausted. You're going on fumes and you're just trying to barely make it. And then we talked about the decreased sense of accomplishment. Now, one of the other facets about burnout is that it happens in phases. So it's not just something that just came on today and then tomorrow I'm feeling great. It has 5 phases. And phase 1 is our honeymoon phase. So that's the time when you're really excited about where you're working and what you're doing. Then you have the onset of stress. During this onset of stress period, you might have a little bit of stress. Some of it might be brought on by you with unrealistic expectations, and sometimes it could be brought on by where you're working that you have unrealistic expectations. You might have a little bit of symptoms here and there with a little minor, maybe a minor headache, but it usually will probably go away. When you have chronic stress, when you have not worked out on the acute onset portion, then you start to feel overwhelmed. Your head's above water, you're barely making it. At this time, you are now having the headache that won't go away. You have the upset stomach that does not go away, and you're going to your doctor, your specialist, to try to find what is this underlying cause. But all the medical reasons are coming back normal. Right? So the images are normal, the CT scan, the MRIs are normal, the endoscopy because you're getting scoped because you swear you have an ulcer but it's normal, but it's all related to just this constant stress on your body, so you're overwhelmed. Phase 4 is literally the burnout phase that we talked about, with is the exhaustion, which is depletion of energy, the detachment, and the decreased sense of accomplishment. Now, the challenge about phase 4 is that you might start having some symptoms that are likened to anxiety and or depression. So you might have periods of times where you're just feeling like you might not even want to get out of bed, or everything around you, you're just having anxiety reactions that might manifest in different ways. Some might be anger outbursts, or you're having sense where you don't want to be around anyone. You might start seeing some changes in your body habitus, either excess weight increase, or you might start to lose weight depending on how you react to stressors in your life. Now, if we don't intervene, then you move on to the fifth phase, which is called the crisis phase. And in the crisis phase, this is one where it truly starts to mimic, and it's a bridge for the true psychiatric illness. So in the crisis phase, not only are you seeing signs of the anxiety and depression, but you might also see signs of hopelessness and helplessness. So for those who aren't in the medical field, hopelessness and helplessness, when you feel helpless, it's I can't do anything. There's nothing that I can do. When you're feeling hopeless, then you have no outlook. It doesn't make any sense. I try to do anything because it's not going to change this. That's when you're in a phase what we call, sometimes you might call learned helplessness, where you're saying what's the point? What's the use? It's not going to change anything anyway. I'm still going to be in this, and then you fill in the blank. I'm still going to be at this job. There's nothing that I can do. I have no control. No one's going to help me. I might as well suck it up. I don't feel like being here, but I have no other choice. I need the money. My family needs the insurance. My family needs, so I just have to deal with it. But then that's like constant pressure. And you can see how that pressure can bring that person on from that hopeless state and that helpless state to a state where it can start having what we call intrusive thoughts, where why you're such a bad person. If you were truly a good person, then you would have left that job a long time ago. And these thoughts can permeate and just continue in someone's mind and then bring them to a state where they now are truly in a state where we don't want, which is in the mental illness portion, where they're at risk for self-harm. So that's why it's so important for us to really tap into and treat the signs and symptoms of burnout and to invest time in that, because people, once they recognize it, then we can prevent this last phase. We can prevent that bridge to the illness that can happen.
Wow, yeah. Thank you for teaching us about the 5 stages of burnout. I suspect that maybe we learned that in medical school some point in time. I didn't recall everything, but I really appreciate going through all the 5 stages. And for somebody who's listening to us, at what stage should they perhaps reach out to you? Say a lot of professional women are listening to us and they're like, okay, yeah, I can relate. Is it maybe too early or is it too late? When should they reach out to you?
I absolutely love that question. So reaching out when you're at stage 3, going into stage 4. So stage 3 is the chronic stress. Stage 4 is the burnout. Now, the reason why that I mentioned this is stage 5, we said, is the crisis phase. When we're at stage 5, having a coach, which is what I do, can be a good supplement, but you're also going to need the professional treatment. So you will need to either see a psychiatrist, a therapist, there's a great chance that you're going to need an intervention that requires medication and management. So that plus a coach, yes, will help you to pull you from that state to get you back to the former you or the newer version of you. But by stage 3 and 4, I think it's good to be able to get the coaching that gets you back to revert some of these symptoms or get you back in control and feeling empowered about your life, because that's what happens with burnout. You lose a lot of control and your mind tells you have no control. So once you can get some of that back, then you can get the decision from the newly empowered version of you. Once you get to the crisis phase, the intervention will take, of course, longer, but it's also wiser to be able to get some medical and professional intervention in addition to coaching.
I love that. And I can also see how truly balanced wellness care would fit into the stage 4 as well, if somebody's seeing the weight gain. So to me, I can see how both companies are connected because it's a continuum of what you do. That is so spectacular.
Thank you. Absolutely. And like you said, this is all from a heart of service and a heart to support. So how can I support? And how can I do this in a way that's authentic to who I am as a person?
I have so many questions I want to ask you. There were some things we had planned to talk about. What is an energy audit and the pause technique? But in order to respect your time, what I'm going to do is I need to have you back because I have
Absolutely.
Yes, and I want to talk more about truly balanced wellness care. You talk about compounded medications to help us with weight loss. I have a lot of questions about that as well. So I think we could have an episode 2, an episode 3, and then depending on what you say, you seem to be full of surprises and tricks. I'm sure next time I talk to you, you're going to tell me something new there. I'm like, I have to have you back to talk about this as well. So I would love to have you back if you're willing to come back.
Absolutely. It'll be my pleasure to come back and to be able to pour into your audience a second time.
Awesome. And for now, for our audience who wants to reach out to you, say to talk more about burnout, they recognize that they're having some of these challenges in their life and they don't want to get to the crisis point or stage 5. Where can they reach out to you? And what are some of the things they can expect in terms of preparing to work with you?
Absolutely. So if you are suffering and you're a high achieving woman who is suffering from burnout, you can reach me at yourcaringdocs.com. That's URCARINGDOCS.com. You'll see ways that we can work together. Our program is called Thrive. And if you want to go directly to the Thrive part of the program, then go to yourcaringdocs.com/Thrive.
That is awesome. Thank you again so much for taking the time to talk with us and to share with our audience about what you do, how you can help them with burnout, how they can prevent burnout, how they can recognize burnout in themselves, and your heart of support, of service, and how you want to serve and help them out. We will make sure that we put all the links to both of your websites below the show notes so that people can reach out to you. And we will make sure that we let people know when you're coming back so that they can tune in and hear the episode. Because I have too many questions and I'm sure people also want to learn more about burnout and how they can empower themselves to overcome burnout.
My pleasure. Thank you so much, Dr. Anita. Thank you so much to your audience for taking this time out to listen. And I'll let you know this from the bottom of my heart. For those of us who do put together information and interview, we don't take it lightly. You, our audience, who give us your time. So I do want to just thank your audience again for their support, for listening and taking the time out to listen to our conversation.
Thank you. We will talk soon.
All right.
Bye.